All right, let's dive right in. Today, we're essentially stepping into the ER to crack a case where every single second is critical. We've got a patient, we've got a set of clues, and we've got a medical mystery to solve. So here's the situation. A patient is wheeled in, and this is what you see. Weakness down their entire left side, the right side of their face is drooping, and their speech is a mess. It's a classic, terrifying puzzle. Our job is to look at these symptoms on the outside and figure out exactly what's going haywire on the inside. This is pure detective work. So, where do we even begin? Well, to make any sense of this, you first have to understand the brain's most fundamental and, frankly, kind of weird organizing principle. Think of it like a bizarre but brilliant wiring diagram. And that wiring diagram is all about one word: contralateral. It's a fancy term, but all it really means is opposite side. It's simple, really. The right half of your brain is the puppet master for the left side of your body. And your left brain? It's pulling the strings for the right side of your body. It's a completely cross-wire system, and it's absolutely crucial for this case. Okay, so let's use that rule right now. Our patient has weakness on their left side. So, using what we just learned about contralateral control, where's the problem? Not on the left side of the brain, right? No. This clue points like a giant neon arrow directly to a problem on the right side of the brain. Just like that, we've cut our search area in half. All right, so we're zeroing in on the right cerebral hemisphere. But what exactly is the problem? Well, the most common offender in a situation like this is some kind of blockage. So let's look at our prime suspect. And that suspect is called an ischemic stroke. The easiest way to think about it is like plumbing. Your brain has this huge network of arteries delivering blood. An ischemic stroke is basically a clog in one of those pipes. An artery gets blocked up, and suddenly, a whole section of the brain is being starved of the oxygen it needs to survive. And that's why the symptoms hit all at once. So, does our evidence fit this theory? Let's see. The left-sided weakness? That's our big contralateral sign, pointing right to the right side of the brain. But what about the right-sided facial droop? This is actually an ipsilateral sign, meaning it's on the same side as the brain injury. It's a bit of a curveball, but it happens because the cranial nerves that control the face are wired up a little differently than the nerves for your arms and legs. And finally, the slurred speech. That's called dysarthria, is just weakness in the muscles you use to talk. You know what? All of these pieces fit the picture of a right-side stroke perfectly. But hold on. A good detective doesn't just look for evidence that proves their theory. They also have to actively rule out other possibilities. So what's the alternative here? The other major type of stroke is called a hemorrhagic stroke. Now, if an ischemic stroke is a clogged pipe, this one is a burst pipe. A blood vessel in the brain actually ruptures. Maybe it was a weak spot like an aneurysm, and blood starts pouring into the brain tissue itself. It's a totally different event, and it gives us a totally different set of clues. And putting them side by side really makes it clear. See, our patient showed up with that one-sided weakness and slurred speech. Those are the classic signs of an ischemic stroke. What they didn't have was a sudden explosive headache, the kind people call the worst headache of my life, or a super fast loss of consciousness. Those are the telltale signs of a hemorrhagic stroke, a brain bleed. The fact that those symptoms are missing is just as important as the ones that are there. So, we've followed the breadcrumbs, we've analyzed the evidence, we've ruled out the red herrings. It's time to put it all together and officially solve this thing. Based on everything we've seen, the contralateral weakness on the left, the ipsilateral facial droop on the right, the slurred speech, and the total lack of signs pointing to a bleed, the diagnosis is crystal clear. Our patient is having a right-sided ischemic stroke. So if there is one thing you remember from all of this, make it this. When it comes to controlling your body's movements, your brain is a mirror. Symptoms on one side of the body are a giant red flag that something is going wrong on the opposite side of the brain. That rule of contralateral control is the master key to decoding where a stroke is happening. And that brings us to a final, pretty wild question. We've just seen what happens when one side of the brain gets damaged. But what if the damage wasn't to one side, but to the connection between the two? What happens when those two powerful hemispheres just can't talk to each other anymore? Well, that is a whole other medical mystery.